Okay, good to see everybody. Oh, yay, Chris. Wonderful. It is 2:00. I'll call this meeting to order of the Safe and Healthy Schools Commission. If we could start with roll call.
Yes, Arif Muddin,
Here.
Sarah Porter,
Here.
Natalie Sanchez,
Here.
Chris Smith,
Present.
Charlene Bybee.
Here.
Jessica will be absent today. Pig Samples.
Here.
Elizabeth will be absent today. Mackenzie will be absent today. Ashley Daftery,
Here.
Jorge Montano,
Here.
and Annie Zucker.
Here.
You have quorum.
Thank you, Sylvia. Let's move on to the Pledge of Allegiance. If we could all stand. Thank you all. With that, we'll move to item 2.01. This is for approval of the minutes from the February 2nd, 2026 meeting of the Safe and Healthy Schools Commission. This is for action.
I motion to approve the February 2nd meeting minutes.
Is there a second?
Seconded.
Thank you, Commissioner. Is there any public comment?
No public comment.
Okay, all those in favor? Aye.
Aye.
Any opposed? Great. Motion carries. On to item 2.01. This is for presentation, discussion, and possible action. This is to recommend bathroom safety strategies for the Washoe County School District to be shared with the Board of Trustees. So this is a culmination of lots of topics and different meetings that we've had, and we welcome Dr. Lamarca.
Hi, Chairperson Sanchez, members of the Commission. For the record, Paul Lamarca, Chief Student Services Officer. Before we get started, I just want to apologize again to the Commission for last month, and thank you all for making sure you're able to be here today, because we have an important meeting. Might be a quick meeting, but we have an important meeting. So as Chairperson Sanchez said, these next two items are kind of a culmination of work that really the Commission has done over the last couple of years. If you recall, the Board of Trustees helped establish some goals for the Commission, and one of those was continuation of our kind of responsibilities around reviewing policy. And an area that kind of fit within this is around bathroom safety. They've been asking us to take a look at bathroom safety for some period of time. We have had a number of different discussions around bathroom safety, really all last year and this year. We've heard from principals, we've heard from students. We actually heard from principals on a couple of occasions. We did an informal survey of principals. We also brought forward some national best practices. When we surveyed the principals, there were a number of things we asked about, like how big of a concern is this for you? How's it affecting access for kids, et cetera? We got that feedback from our principals. And so just this is really just review. So for our administrators, really there's kind of a difference. I think at the high school level, it is seen as more problematic than at the middle school level. And at the middle school level, it's still seen as problematic, but some folks didn't find it to be terribly concerning. All of our schools, though, do have practices where they limit access during the day, and they accomplish that through a variety of strategies. And most of our schools, and I would hope all of our schools, really have a uniform approach to how they try and keep bathrooms as safe as possible. Below you have some of the specific strategies that were mentioned to us. So sign in, sign out kind of processes. If the kid is late coming back, we do, some of the schools do a thing called restore at the door. Well, they'll bring an administrator down and they'll talk to the student about what happened to try to prevent that from happening in the future. Limiting the time kids can go to the bathroom at the beginning of a class period, at the end of a class period, those sorts of things. And really having eyes on the bathrooms during passing and during important breaks like lunch. And so that's actually one of the requests that our principal shared with us. All of our schools, I think, would like some work, especially the older schools, not the newer schools, because they already have this, but they would like some work done with their existing bathrooms, if possible, retrofitting them so that they're gender-neutral types of stalls. They would like expanded Wi-Fi and camera access, not cameras within the bathroom itself, but sometimes just because of where they're placed, there are blind spots. And so trying to have as much visibility school-wide as possible is helpful, and especially outside of the bathrooms, because while you can't have a camera inside, when kids come and go, you can timestamp and you can kind of figure some things out. Additional campus monitors. Campus monitors are essentially like a position primarily at our high schools. It's folks that just really assist with roving the school and monitoring what's happening. And these guys, it tends to be guys, tends to be men. They regularly do the bathroom sweeps, but others are doing bathroom sweeps as well, administrators and even teachers at times are at least having eyes on bathrooms. And then, as you know, we've had several presentations around vape detection. You all recommended as part of that policy that vape detection could be part of a comprehensive plan, and our schools are asking for it. And we're doing some of that. Tammy Zimmerman is here. She could comment if necessary. She's talked to us about our plan in the past. Highlighted national practices make it very clear in guidance that there will be consequences for doing things in bathrooms that create unsafe conditions, and this needs to be done at the district level, but also at the school level through our PBIS process, things of that nature. Making it easy for students to share problems they're experiencing, and also regularly seeking their feedback. And I do think some of this is in place, but we can always get better at that. And then maybe, and this is an idea, and you're going to see it in a minute, is creating some peer advocacy materials that try to frame this in a way that students might be able to do in a way that adults can't, and so that they can try to convince their peers that these ought to be safe places for all of us to access. So that's kind of a summary of what we covered in the last couple of years. What you have up here for your consideration are some recommendations. Remember, the role of the commission and the district committees are to provide recommendations to the Board of Trustees and or the superintendent. So we're not taking action today that will change something tomorrow, but what you'd be taking action on today is recommendations that we would present to the Board of Trustees and or the superintendent as relevant. So there are some district level considerations, school level considerations, and I don't think there are any surprises here. You could recommend that the behavior manual be revised so there is some explicit attention to the consequences when behaviors such as substance use occur within a bathroom. It might change the progression of discipline, for example. It might be taken a little bit more serious. We could develop, or we could try to work with Student Voice to have them develop some peer advocacy materials. We could, and this is, again, another interesting thing here to remember, is that you're providing recommendations, you're not obligating budget. So some of these, even if we recommend it, there'll have to be budget for it to occur, but you can't control that. So it shouldn't stop you from making a recommendation. So budget permitting, you might want to recommend the expansion of vape detectors perhaps into the middle school level. Timely repair of bathroom issues. This is something that if it came in the form of a recommendation, it would eventually go to Tammy Zimmerman's shop. And really, it has to do more with what happens within the building. But at least Reno High School, and I think one other school, found that when they attend quickly to problems in the bathrooms, damage, it makes the kids feel better, and it makes the bathroom accessible. So it's a good thing for us to do. And the retrofit of bathrooms and the expansion of Wi-Fi. Again, those would be very costly sorts of things, but that's not a reason not to have it as a recommendation. You could also make some recommendations for school-level actions that could be taken. And again, those would probably primarily go to the superintendent, and then they would get passed down if he or she sees fit. So with that, I'm happy to answer or try to answer any questions. And then if you're willing, you could make a recommendation and take action.
Commissioner Bybee.
Thank you. I have a question on the retrofit of older schools. Obviously, the first thing I jump to is cost. And is it feasible to retrofit the bathrooms in older schools? And I guess more importantly, because I don't know that I was totally a fan of these bathrooms from day one. I'm still trying to get sold on them because I think they've gone better than I expected. But what is the benefit from an older school that has your standard boys and girls bathrooms to going to the unisex bathroom model? Is there a benefit to that? And obviously, cost for me is a big thing. But is it a benefit or is it a challenge?
For the record, Tammy Zimmerman, your Chief Facilities Management Officer. So we are retrofitting older schools in our modernization. So Matthews Elementary School is receiving a bank of general use restrooms. We don't call them gender use restrooms. We call them general use. They are also getting a bank of them retrofitted at Reed High School through the modernization. And we're also doing another different bathroom type of renovation where it can still stay male and female, but the bank of the sinks are at a pony wall, and you can see over the top of them still. While you don't still have male and female going in, you can use that camera that's in the hallway to still see who goes into the bathrooms and that. The partitions are more floor to ceiling, and that has yet to be built. It'll be built in next summer into Reed High School. But trying some different things. They are a little bit more cost effective to take down one wall as opposed to several and have to put that in. When you do the single stalls, you have to put a fire alarm and all of those pieces in there for safety reasons, so they are a little bit more costly. So we're trying several different models of those to see what is the most cost effective and what works, right? We don't want to put it out there if it's not going to work for everybody. So we're trialing a couple of those.
So I guess my core question is still, is it a benefit to students to have these bathrooms over your traditional bathrooms? And if so, what is that benefit?
I will tell you the feedback that we've gotten from students is they like them because they are in an individual stall that they feel safe in, as opposed to behind a wall with several stalls that there's no visibility to.
Other questions? Yes, please.
Thank you. Dr. Lamarca, students evidently raised concerns about privacy, the gaps in the doors, et cetera, the removal of entry doors, mirrors that were removed. None of the proposals necessarily recommend addressing the physical privacy improvements. Is that a recommendation that we could put on the table as well? Is that something that's feasible?
I do think the general use stalls does get at privacy, but yes, you have the latitude to make, you got to convince your fellow commissioners, but to make additional recommendations, absolutely.
I have one more follow-on, different topic. So there's a district level recommendations and there's school level recommendations. Are there, from your perspective, application of the district level across the board, given the fact that we didn't have principals all on the same they were on the spectrum this is a problem, this is not as much of a problem. Enforcement of that across the board, what does that look like from the district level?
Are you asking about like accountability? It's a really good question. Thank you for it. I think that your recommendations really are geared at the district level. However, if you choose to also make these recommendations that are more site-specific, that does help build in this layer of accountability. I think what we need is a shared sort of agreement among district staff and school staff that these things to keep bathrooms safe need to be in place. And then it is a matter of monitoring and evaluating and getting feedback, and when things aren't occurring as has been recommended, assuming the board superintendent also share that, then it is a matter of holding folks accountable. But I'm not sure right now, you shouldn't always have to have policy in place to do the right thing, but it sure doesn't hurt, and I know you know that. Yeah.
Commissioner?
I was just going to ask about, is there the ability to place timelines on these recommendations? Because, you know, they just say revise. Do we say revise by, or is there a way to be able to put some kind of timeline into the recommendations?
Thank you. I think you can. I think, something I think I can share, I'll be told if I can't. We are hopeful that the commission will get to speak to the Board of Trustees in June. Sort of annually, they ask us to come. And depending on what you do today, that would be an important part of that conversation with the board. The behavior manual, for example, is published annually. And I think that you certainly could word your recommendation in such a way that if the board agrees, we'd like to see this in the next iteration of that behavior manual. So you can do some of that. It's a little bit hard around like installation of vape detectors because that's going to follow a construction plan that's already sort of in place. But you are not prohibited to putting in recommendations regarding you think these things should happen as soon as possible, or you think they should happen on a 2-year period. That would be your latitude.
I want to check in also with the commissioners online real quick. Does anyone have any thoughts, opinions, questions? Okay, Commissioner Porter.
Thank you, Sarah Porter, for the record. I completely echo what you were saying around physical safety, just being the parent representative. That was a big reason why I've been so vocal on this particular issue, because physical safety is the #1 thing that my boys come home and say, I didn't use the bathroom at all today because I was afraid to go in there. That said, the retrofitting of the bathrooms is helpful because you have your own stall, people aren't kicking them in or putting things under or over the stall while people are trying to use them. So I definitely think making sure that that is part of the recommendation is crucial. Also, the monitors, being able to have people monitoring those particular areas and giving those parameters so that that physical safety is accounted for. I would say in the recommendations, it does seem like the physical safety is accounted for in how you've put this together, and not just vaping and not just, bad behavior in other ways. So just wanted to kind of add that or lend that, being that we get to hear that firsthand.
Other thoughts, other ideas? I just want to say I'm very happy to see especially the school level considerations, because one of the things that I hear a lot of, particularly from kids, is they're not sure what happens when there is misbehavior in a bathroom, and how to make that fair, especially in a kid's eyes across the board, is really important, and I think helps keep everybody, helps the environment be a little more respectful that way. Commissioner Smith, was there anything in particular in terms of the recommendations? And Sylvia, maybe we can go back to the recommendation slide that you felt like was something to add, or do do you feel like what Commissioner Porter's saying in terms of some of that physical safety's been addressed?
Thank you for the question. I think, let me go back to my notes real quick. I feel like Dr. Lamarca's answer satisfied my concerns when it comes to the general use retrofits. So for those schools that haven't had those yet, I think that as long as we see that there is progress in that direction, those address my concerns. Thank you.
Vice Chair, did you want to add in terms of any recommendation, anything in regard to time?
I mean, I would say that those things that, oh, sorry. I would say that those things that wouldn't need to go through a budget should be done this year. Obviously, the things that need to be reviewed and go through budgeting take longer. And we can't really put a timeline to those things unless they were approved in a budget. But those that do not need to go through a budgeting process, I would say that we should try to get those done by next school year if we are making that recommendation. Unless that's really difficult.
May I ask a question? When you say next school year, you mean by the end of next school year? The one I'm a little concerned about is, or not concerned about, I'm actually really looking forward to it, but it's going to take a little time. That's the development of peer advocacy materials. I think the best approach would be to work with student voice, have it potentially be a project at the district level as well as some of the schools. And so it might be that takes some time. That would be the one. So if it's the end of 26, 27, I think I agree with you.
Yeah, or even the establishment of that work or those work groups or things like that, just to get the ball rolling on things would be important.
Would it be reasonable to say, in terms of these recommendations, as timely as possible? Is that enough?
What is timely?
Yeah, what is timely?
You said something about the student handbook is revised every year. What does that mean? When is that?
So there's a statutory requirement that we don't have to revise it every year, but we do. We have to turn it into the state by, I believe now the date is September 15th. So Lindsay Kendrick, I'm sure, is already busy working on that. This is one that I think you should recommend, and we should get that in there. And I do think that she would be open to trying to get it into this coming draft. Legal would have to review the language because it's a little different than what we've done in the past.
Yeah. So if we revised it to say for that particular line item by the next iteration of the handbook, and then the materials to have it started by the beginning of this coming school year. And I think the rest of them are tied to budget, yes?
Yeah.
And the others to be as budget or time or budget meetings allow. How do we say that legalese?
I do want to add just a little bit for you guys. I know you guys are going to come to the June meeting. I'm also coming to the June meeting to the board to talk about additional safety and security funding to continue and to even ramp up the bathroom retrofits. So you guys know it's not, you can't put a timestamp on it because it does take us in construction, but I'll be there the same time you are talking about our capital renewal and putting, another chunk of money towards that. So beyond just our modernizations that we're already doing.
Okay, I think with those, maybe with some of those changes, sounds like revise the manual by the next iteration and the materials to move forward with some of these changes that are possible by next school year, then it looks like someone could make a recommendation if they'd like.
Thanks, Sammy.
Yeah.
Okay, I'll move to make a recommendation that we accept the possible recommendations to present to the board with the changes of having the behavior manual, are these changes included in the behavioral manual by the September iteration of this year, and that the peer advocacy materials promoting respectful bathroom use get started with this next school year, so 26, 27, as students are available. And then the rest of the recommendations will be budget dependent.
I will second that. Manny Zucker.
Anybody opposed? Oh, Commissioner Smith?
Discussion?
Yes, discussion.
Thank you.
Yes.
Just want to make sure that are we considering the school level considerations as well as part of that? Because some of those could be date dependent and don't have a financial tie to them, like clear school expectations, approach, and consequences for bathroom misuse. Beginning of school year
Yes.
2026, 27?
Yes,
Yes.
I was assuming that that would be part of the handbook,
Yes.
the manual.
Yeah.
All right, just wanted to make sure that we were clear on that.
Yes.
And Commissioner Daphne?
I had one follow-up question. If we are considering all of the potential recommendations in terms of expanding installation of vape detection, is that something that there was a lot of support from middle school principals? Because in our prior conversations, we had discussed lack of national data that indicates actually any decrease of use, and perhaps maybe there is some state level data within the district. But before making a recommendation to consider this, I think it's important to have that information.
Thank you for the follow-up question. I think most of the data available to us right now is anecdotal, based on our current experience. I will share with you that the high schools who've had the installations all believe that it has had a deterrent effect. And I promise you when I say in every setting I've been at when this has come up, with a couple of exceptions when bathrooms were just not conducive to these sorts of things, which actually are the newer schools, every principal has wanted it, middle school and high school, and all students have said it's a good idea as well. But we don't have a rich source of empirical evidence.
Thank you.
Yes, please, Dr. Lamarca.
Just want to make sure we manage kind of expectations a little bit. So the school level considerations is a really good question. I do think that we could stick with this idea of by the end of the 26-27 school year. So right now, schools are developing their school improvement plans. Those are essentially due before the end of June. It used to be later, but now it's by the end of June. The manual that we're talking about, that goes to them right at the beginning of school. They review it with a committee, they see what the changes are, and then they begin to implement. So in terms of them like articulating their own sorts of things, that may take them the full year. But we can get the ball rolling. It won't be done at the same point in time.
Do we need to amend that then? To say the first school level? Okay, so I'll amend the motion to say the school level considerations to be completed by the end of this next 26, 27 school year.
Before we vote, is there any public?
I'll second that.
Do we have any public comment, Sylvia?
No public comment.
Okay, let's go to a vote. All those in favor? Aye.
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 Any opposed? Great, motion passes. Thank you. Thanks for another good motion, Commissioner Porter. On to item 2.03, presentation, discussion, and possible action to recommend the implementation of screening, behavioral intervention, and referral to treatment, SBIRT, screening for teen interventions instead of the current substance abuse prevention courses in the Washoe County School District, to be shared with the Board of Trustees. This is for possible action, and Dr. Lamarca, thank you for taking us through it.
Thank you again, Chairperson Sanchez, members of the Commission. For the record, Paul Lamarca. Thank you for that last vote. So this is similar. We've actually been working on this a little bit longer. You have, as a commission. We really started kicking this off 3 years ago, where we were reviewing policy And your recommendations helped form that change policy. It was built largely around prevention. And so I really see these as part of that prevention piece. The vape detection is really more of an intervention or response to it. This is more around prevention, or at least matching appropriate resources for students who are in need. So again, you've had multiple presentations around this, and the last presentation that you had was just the last time you met. It was from our new director, Keely Killian, Director of Counseling, and she talked to you about Teen Intervene. It's actually a quite expensive program, and that's something to know. But we feel like it has some great promise. What we've been able to do so far was made possible through a grant from the Rotary Club, and really that resulted in the training of representatives from most of our high schools. They weren't all there, but we got a lot of people trained. A big piece of Teen Intervene is this ability to screen students. I can't see anymore. Yeah. So if we have a student for talking to a counselor and maybe sharing that they have been exploring drug use, alcohol use, if we have a student who is caught possessing something or under the influence, we could then use this screener to really get a sense of how bad the situation is so that we can more appropriately support the child. I think the big difference, what we're really trying to do here is move away from the current SAP model and move more toward a model embedded in each of the secondary schools. And that's going to take some period of time. Any recommendation today is not going to result in that. It's going to move us in the proper direction. The SAP model, and Keely also presented some of this to you, this is a model that's been in place for a long, long time. It used to be essentially a trade. If a student got caught, say, with a joint, and they were suspended for 10 days, which we no longer do that, they could reduce the 10 days down to 3 days or 5 days if they would go participate in this program. And the program is a 4-week program, 1 night a week. Your parents and the student had to participate, had to do it 4 weeks in a row. They couldn't miss one location for the entire school district. So you can see that, well, if you're a family living in the Worcester zone, it was pretty okay because that's your school. If you live out in Cold Springs, you're having to come a long ways for this programming. It's also primarily information sharing, and I would say it's very good. I might have a child who went through it. However, it's not, we don't see strong evidence of its efficacy, and we think that this would be a better fit. Our counselors, our mental health professionals, they know the students they're working with. They're going to have a better chance of helping change coping strategies than we are at Worcester High School for the district as a whole. We don't have a lot of budget to support SAP. And we have another little pot of money around violence intervention. What the recommendation essentially would do, and this would require board approval or superintendent approval, would be for us to steer those budgets towards Teen Intervene to increase the expansion of that. We would also be looking for grants and things like that in order to do that. So that's really what the recommendation is, or what we're asking you to consider as a recommendation is to move away from SAP programming, to begin scaling up Teen Intervene. This would allow us to perhaps purchase more material. The materials are expensive. Train additional staff, and if we have some extra money for stipends to really begin piloting the process and seeing how it's working within our schools. That's all I have.
Thank you, Dr. LaMarca. Go ahead.
I can't remember if Keely had touched on the time commitment or if we have the capacity. Even with the materials, does the staff have the time and the capacity to work with the kids with this program?
That's part of what we have to, thank you. That's part of what we have to determine. I do think currently for the SAP program, we are paying some stipends. It's at night, it's off hours. We do have a process for supporting employees when that's required. It would require more work on the safety teams, probably some work after hours or before school starts, or at times during the day. It depends. It depends on if they're doing groups, those sorts of things. So I can't answer that with certainty at this point, what it really is going to require. In terms of capacity around the materials and the training, we can get that done. If we can fund that, we can get that part done.
Other questions? Commissioner Smith?
Chair Sanchez, thank you. Chris Smith for the record. Dr. LaMarca, I don't recall in Keely's presentation last time, was that in February, I think? Apologies on not remembering that one. But a clarification, what, with the SAP, we required parent and student participation. For Teen Intervene, there will be still some parent, what is that parent component? And is that something that, like, how does the district plan to still address some of the transportation and or language barriers that would be presented at something like that at the site level?
Thank you for the question. I will need to go back and talk with Keely and get back to you on a specific parent component. So there will be there is parent involvement in terms of signing off on permission for screening. And there would be parent permission required if, for example, our mental health professional is providing sort of group therapy or even private individual therapy. There is already a process for that. So the parents will have a couple of junctures where they're involved. I do believe Teen Intervene provides some parent components in terms of programming, but that's probably a little bit beyond our scope at this point in time. But I want to qualify with her, and I'll send a message to the entire commission based on her response.
My understanding of Teen Intervene is that it's the third session where the parent is involved. So there still is a component where my understanding is you do have to come, but it's not every session. Yeah. Other questions? Do we feel ready to make a motion on this? Would anyone like to take a shot at a motion? Go ahead, girl. Oh, here.
Okay, I'll make a recommendation that at the district level to consider that the school district move away from SAP programming and that the school district begin scaling up Teen Intervene efforts, purchase additional Teen Intervene materials for secondary schools, train remaining secondary schools, use stipend funding as available to pilot Teen Intervene after school programming for 2026-2027.
I'll second that motion.
Okay, great. Is there any public comment on this, Sylvia?
No public comment.
Okay. All those in favor?
Aye.
Aye.
Any opposed? Okay, hearing none, the motion passes. Thank you, Dr. LaMarca.
Thank you.
Now we move on to item 2.04. This is for presentation and discussion only. And this is the plan, the dissemination plan for the safety videos that we put together from the commission for the parent toolkit, frequently asked questions sheet for the Washoe County School District students, staff, families, and the community at large. And we welcome Andy. Good to see you.
Hello, everybody. New microphones. Okay, so we did work with the recommendations and the talks we had the last time. focusing on the resources that we do have and how to better utilize them, and then weaving in some new things. So in the agenda, in your materials, you got the communications plan that we created. I printed out a few extra if you guys don't. I don't know if anybody wants. Yeah, yeah. Only two, but they're, yeah, so it's, you see it there on your screen. And then I have sort of a visual aid to kind of walk us through it so we can look at the website. So the goal is to help families more easily find and access safety, wellness, and mental health resources that are already available. That's what we talked about last week, or last meeting rather, and that sometimes people just don't know where to find them. And so we're going to try and boost and amplify that. So promoting existing resources. And let's see if I can click my way through. Okay, which is our website. This is our biggest one. So here's the Safe and Healthy School Commission main page. This is just a screen grab so you guys can see what it looks like. That's the existing page now for safe and healthy schools. And then the second half kind of the page, there you go. That's the second half of the page. It continues down. It sort of shows all your names and everything like that. But you'll see there, safety information for families. There's a link now there for the toolkit. And that is one of our biggest resources there. Yeah. So we have the link there. We put that there. So that's a start in the right direction. And that toolkit looks like this. This is, again, the top of that web page, Safe and Healthy Schools Toolkit. And you'll see down below, it goes into physical safety, vaping, digital safety, which I'm going to take you through right now. So this is physical safety in the building. Again, this is a screen grab, the top of it. As you keep going down, there's a very long list. So it depends what interests parents. And it's there. Clicking through. Physical safety, this video is on there. This is one that we created together because of the Commission's guidance, the traffic safety near our schools. So that's on the physical safety. So there are links that will take them elsewhere. There are links that we have here. Vaping, again, a very long list of different resources available for parents. It keeps, as you scroll down. And then digital safety, again, that's a big one, right? Of course, all of our kids, all of us are dealing with this now. Digital safety, you scroll down, many, many options there available. Social, emotional health, and safety, again, more to go through. And on that one, we have our videos here, Stronger Together, Building Safe and Connected. That's Future. That's one of the videos we worked on this year, last year. And then the other video that they can find there as well is supporting our students' mental health. So again, those are already existing. And then the next one, existing. Okay, so here's where we can start making some changes that we put in our comms plan, our communications plan. On the front page of every school website, at the bottom is this section here called Explore Our Schools. And it has those 3 tabs underneath. And we try to customize it, and we did for when we built our new website. So you'll see there's the Family Resource Center, Safe Routes to School, Healthy Students, Healthy Schools, and those are links. We have found that the schools themselves have not really changed them. Each school is supposed to be running their own page, but they're busy running their schools. And so we want to we'll take over this part, and we can do more of safe and healthy in school or safe and healthy school topics in these 3 tabs. This is an elementary school, so as you can see, the resource centers that we have, those are very important to our families, so we almost always have that. But Safe Routes to School is something that, we would use maybe more in our lower grades than our upper grades because we have like little kids riding bikes as opposed to the high schoolers who are driving. So this is a new area, or not a new area, but this is something that we can utilize and leverage to get more information out. And so over the summer, that's something I can work on, is really like creating more of those resources so that when they're on their child's school website, they see it there. Because one of the things you guys brought up was that parents don't know where to find it. It's a huge website. So with the assumption that they'll be at their school's website, their child's school's website, we would use those Explore School tabs. Safe and Healthy Schools, this is, again, your website for the commission. If you look at the top, it's a very long URL. We can change it, make it a little snappier and shorter, what sometimes it's called a vanity or whatever, and just a little bit easier to remember. It may not be the most important thing, but it could make things easier if someone remembers, WCSD, safe and healthy, or something like that. So that's an option, and easy enough to do. Social media. This happens to be Instagram. We use LinkedIn, we also use Facebook, and that is, again, an existing platform. We know everyone is on social media, and we want to go where people are. And so one of the things that we could use social media for is, and I believe Commissioner Bybee, you recommended this, was that Did You Know awareness series. And social media is a perfect fit for that. So right now, we would conduct a 6-month awareness campaign with new posts approximately every 2 weeks as capacity allows with the Did You Know. So again, did you know that we have counseling webpage? Did you know that we have in all the resources? So again, just leveraging where people, finding them where they are, leveraging our existing resources, and just reminding people where they are, or pointing them to where they are. We could do, they would be brief, visual, and again, circling back to safe and healthy schools commissions and commission and resources we have. Some example focus areas there could be Care Solace, which we have, mental health coordination, Safe Voice Nevada, Safe Routes to School, Kids Cafe Meals. So this can be and would be highlighting seasonally, they would be seasonally aligned monthly things. So like during the breaks, Kids Cafe, so that families know that there are meals available. When it's back to school time, maybe it's traffic safety, really, aligning it and being cognizant of that. And then again, bringing people right back to the webpage and to the resources we have. So that's our recommendation, our comms plan, and certainly after sort of launching it and getting it going, if then we want to revisit and see if it's working, if it's effective, if we want to alter anything, we could have those conversations.
Very exciting. I want to be very mindful that this is not for action. So I'm just going to say I love your ideas. And I think I just really am excited to see it kind of grow and to hear it be tied with things that are timely and relevant for families. And that's very hopeful. So anybody else from the commission that, yes, please, Commissioner Porter.
I just have a couple questions for you. Are you working with the web team to where we can have analytics fire on those particular pages to see what content is resonating?
We do have our data, our team does track the data through Google. It's a certain system. I'm not the one in charge of it, but I think my answer would be yes. I think we could narrow it down. I will check with them specifically for that, but you're saying a campaign of sorts to see like what the hits are on a campaign or something?
Yeah, and I'm happy to talk to you about this offline, but it's more around setting up the Google Analytics, if that's what you're using, or whatever analytics tool, to say, okay, these are the pages that are part of this. Which of these pages, because when I was just clicking through the site, I didn't know if they're anchor links or actual pages, and they're actual pages, so which ones are resonating the most, and then on that content on that site, what's getting the most click-through traffic. That would be really interesting, because that would help us probably guide some future content ideas. So I think analytics and data, and that if you have a good analytics person, it's not hard to set up, it's just a matter of doing. And then do you have any design flexibility on those pages at all to make those call to actions more enticing or more obvious? I know it's probably pretty locked down with whatever the web team has.
Good question. So the website, we do have, of course, guidelines for graphics and content and continuity. Give me an example.
So
if you think.
simple usability things. So right now, when we have the please navigate through the resources, physical safety, vaping, digital safety, social, they're all links right next to each other. So fat finger can get really in the way if you're making those versus them having like individual sections or buttons, or having it be like designed out so that it's a little bit less user error susceptible. And then things like when I was on physical safety, we have, this is a bully-free zone, because it was the first part, and then it says click here for some family resources. That click here is not a hyperlink. You have to go up and then actually click that either the image. So just some usability things.
Okay.
And some design things. Again, I know limitations, especially on a district website, can be serious, but if there is some opportunity for enhanced user experience design, I think that would be really great. I just didn't know what you had.
We have a fair amount, I mean, because it is a communications tool, so we have a fair amount at our disposal, but again, following, sort of district guidelines
Yeah.
and everything, but if it's usability, I think that's an easy fix.
Okay. And then lastly, on your Explorer School footer, has anybody told you if they'll make that like a global element for you? I'm just thinking if you're trying to make that change on every single school website page, that's going to be a nightmare, but they could make it a global element, so you make it once, and then that populates to every school's page. Does that make sense what I'm saying?
We can do that, and
Okay,
we have done that. So like on, for example, the elementary schools, like I said, they all have like Family Resource Center. And yeah, it can be duplicated, you're saying, so it's not one at a time?
Yeah, so you're not having to do it for
absolutely,
each
yeah,
page. Okay,
yeah.
great, awesome.
Yeah, thank you.
Okay, thanks.
Hi, I love this, and you heard it so well. Like, you figured out what we were trying to get at was kind of just what we were just throwing at you, the spaghetti. So thank you. It's really well thought out and well done. The one piece that I'll get on my soapbox again is maybe is there a way to incorporate the community partners into this? So when we talk about like the timeliness or like the those seasonally aligned things, like what is going on in our community with our community partners in those spaces, it might just make it easier because it's already probably content that can be shared from some of our community partners. So if we're talking about child abuse prevention, like who in our community is doing child abuse prevention work and how do we partner with those people? Behavioral health month, things like that, just working with those community partners.
So I don't know enough to answer it fully. I do know that as a school district, we have to be very careful not to look to be endorsing anyone. So there's that. But like Kids Cafe, for example, is created or hosted by Food Bank of Northern Nevada. Certainly, there's nothing wrong with saying that because they are the ones doing it. So is that something like that you mean? Because I know we do have to be careful with endorsing.
Yeah, and so actually, I'm sorry about that. I would actually say the other way around, that we are actually using some of our community partners also to be pushing some of this messaging. So the content that, one way, yes, I said it that way, but now thinking about it, I would actually say use those community partners to be pushing out this messaging as well, because they have a reach to parents that maybe the school district doesn't, or a relationship with parents that the school district doesn't. So kind of both sides of it, but I would say even more using our partners to be promoting these things.
Okay, so in the same way that we would create for a principal or a school some messaging, you're saying work with our partners and say, hey, share our post, or this is our message. Is that?
Yeah.
Okay.
And I see that we have a commissioner online, Commissioner Montano Figueroa.
Yes, thank you, and great work. This is so exciting. I've got the pleasure to work with you in the past. This is amazing, and that was getting my question around data and how we ensure that parents, one, know about this, and two, have that accessibility to it. So I have two questions here. Do we know how friendly it'll be to mobile phones to be able to access this? We know that a lot of our families, their way of being able to access social or the web is only through a phone. So that's one of the considerations. How friendly is it on the mobile site? And then two, I second sorry, your brother, Annie, but Commissioner Zucker's question regarding partners. This is a great idea because, again, as a partner that deals in this space, there's oftentimes I get asked about safety concerns and policies and things of the sort associated with Washoe County, and I can't really answer them directly. This would allow me to refer them back directly to you guys. So is there conversation about including some of the policies within these specific websites? That would be the two things I have to add, but overall, great work.
All right, thank you. I'm going to have to ask for clarification on including the policy. School district policy? Or what? I just want a little.
Yeah, Yeah, if there's any policy around certain items or considerations. For example, the one question I get a lot is around pedestrian and really like safety around the traffic around schools. Like, what are we doing about it? How do we improve it? What is the policy, especially with these schools that have the no drop off areas? Just clarification on that would be amazing within some of these embedded videos that we have or conversations. Did that clarify?
Yes, I think so. So for example, the traffic safety, we talk about that. If you're saying policy next to it that says no U-turns in school zones, that's Nevada revised statute and that sort of thing, or school district policy being next to or on the same page.
Yeah, included in it would be fantastic for, again, transparency and setting the expectation for parents.
And I would just ditto that idea as well, because especially providing mental health care, oftentimes families come into the office and they're like, I didn't know this was a thing. I didn't know this was happening. And so even if there was just a really quick, seasonal update that we could provide, that would be really helpful and be able to point folks like, please check this out at the district. This is what's going on, with regards to traffic, safety, those kinds of things. So that would be great.
Okay. So some more thorough communication with our partners, with community partners, give them the resources to answer some of the questions or point them in the right direction?
Yes,
Is that
yeah.
yeah, okay.
Commissioner Porter, did you?
Yeah, I was just gonna follow up on Jorge's comment, just because I am on the mobile site right now, and it's fully responsive. So I think the bigger thing is some of those fat finger things that we've already talked about for usability, but otherwise, it's a very simple site, so it's laid out pretty fine in terms of mobile use. And then all the videos are embedded, so it's not taking people externally to YouTube. They're all embedded in the site. So I think that's kind of been thought through, it looks like.
We try and keep
Commissioner
'em-
Bybee? Commissioner Bybee, did you have?
Thank you. I'm looking the other way. I love this, and I especially love the did you know? The social media, being able to do that on social media, I think giving people small bits of information and not overwhelming them where they go onto a website and they're like, oh my God, even though this is very friendly, I think just those little tidbits of information and making them, focusing on different focus areas is good. That could also tie into, or could we tie into different months during the year? Because there are Domestic Violence Awareness Month, there is Mental Health Month, there is, through the whole year, you could find whatever the month or the topic, because that ties to the community too, which enhances even more information and more resources around whatever the topic is. But I like it because when it's a did you know, is not so locked in that you can't change and add things through the year. If you're just hitting these little topics, what you planned on in the fall, you might have something else you want to add. And at any time, you can add or take away. I think it's, it makes it more flexible, and the ability, especially when it's something like that we can't foresee, that all of a sudden is a huge issue that we want to do, did you know, on maybe a current thing that happened in the last week or two, and address that and be able to share that information. That gives you flexibility, so I appreciate that. Thank you.
Good discussion. Commissioner Smith.
Thank you, Chair Sanchez. Andy, this is fantastic. 20 years ago, when I was in the district and we didn't have anything like this, this was a dream to have it all pulled together like this. Amazing that parents and the rest of the community can see all of this. My question is about the plan, and specifically, how do we evaluate the measurement of success with the plan? So what is the tool there that we're going to be able to evaluate that? And will the board or will the commission receive an update along the way of how we're doing with the execution of the plan?
So, as we discussed with the data, if we set that up and then again get specific with Google Analytics as to, what we're asking, then yes, then we'll be able to say, oh, it worked. They clicked through. They came from social media. They came from our website, or they clicked a link, so I think that will help us, and I will work with, because I believe it's possible, everything's data now, right? So I think that will help give us some of the answers, or at least some guidance.
Thank you. Quick follow-up. So I agree that the clicks will help us understand some of that. I'm also curious on some of the outcomes. So what is that? What are we driving towards here? What does success look like? Are we looking for lots of clicks, or are we looking for, like, what are the things that we're really looking to, and then that we measure that as well?
Good question. True enough, clicks don't necessarily mean that it's landing as much as we want it to. The only thing that comes to mind is we have the climate survey that we give to parents. That is not our department. However, we can work with them, and I could see if those questions are included. I'm not familiar with what the plan is for next school year. We just finished, I think, the parents' climate survey. That might be one tool, but good question. I can think of other tools. Think about how do we know that the parents are getting the information, short of actual just data if they're clicking. I can see if it is in the parent survey, and maybe give me something to think about to how to create that.
Commissioner Bybee? Oh, your thing is on.
I think I might.
It's okay, Commissioner Zucco.
I was just going to ask if it could be part of the school performance plans, if there's something in there that, I don't know, if we're trying to reach families, the schools are usually like that lowest hanging fruit to be able to reach the families directly, but I don't really know what's written in those school performance plans.
Can I add on to that real quick, Annie? While you're thinking about that, just because I think in several meetings ago, we've talked about when we were thinking about how do we disseminate this information, is the schools do send out a weekly email to parents of like, this is what's going on at the school, this is what's happening, and being able to get on that email of, here's a toolkit for Safe and Healthy Schools. So even if it's a footnote or a link or something like that, that's also a really good way to get that information out to parents.
I think it's in here for, let's see, because we do, a lot of principals have their Sunday message, right? Is that what you're sort of thinking of? And we already do have a every 2-week family newsletter, because I write it, so I know it exists. But we do have, let's see here, messaging. I thought we had developing something for principals. But yes, getting into like the principal's Sunday address, that sort of thing, right? Right. Okay, yeah.
Any other discussion, comments? Okay. Well, this was absolutely fabulous. Thank you. You wildly went with everything, like Annie said, that we were throwing spaghetti at the wall, and you managed to bring it all together beautifully. So thank you for hearing us and presenting the best version of all that. So thank you.
All right, thank you, Commission.
Let's move on to item 2.05. This is for presentation and discussion only. This is to go over the board-approved policy 5800, and this is presented by Dr. Lamarca.
Yes. Yeah, got to change it up a little bit. So thank you. This is just for discussion. And this is actually, been a couple years in coming. You all might recall, some of you weren't here, but you might recall really about 3 years ago, 4 years ago, a lot of scrutiny regarding district committees, attendance, how people were being selected. And this really got, at the time, Chief Counsel Neil Rombardo and myself talking about different committees. Our office actually oversees 3 committees, 2 in addition to the Safe and Healthy Schools Commission. One unique thing about well, I don't know that it's unique. Andrea would know. We have a lot of members of this particular commission, and for good reasons. But you're going to see that's being changed. I'm trying to give you a little bit of history here. As I think you all know, this commission really was born from a tragedy at Sparks Middle School, which occurred in 2012, and then through, I think, well, she wasn't board president at the time of the tragedy, but soon after she was. Lisa Ruggiero really spearheaded this. I know that Ms. Bybee has been on the commission since its inception, and we began in 2014. And at that time, there was a policy that was specific to this particular commission. Talked about, who, why, when, that kind of a thing. That was eliminated when a policy 9100 was sort of brought forward, which really provided parameters around all district committees. And then with time, you learn, and we felt that we needed something unique for this particular commission. So really, this has been worked on for some period of time. Sylvia, if you can scroll down to the next page, and, sorry, Section C, Commission Composition. So here is the real rub. Here's the change that affects us as a commission. And before I get into any more specifics, and I will get into this, I do want to say that we're blessed with an incredible commission. Everyone on the commission is super powerful in their own right. I couldn't be happier. It has been at times a struggle to get strong members, and we've been very lucky. I think we've been much luckier than other commissions, and I don't know how long that luck will continue. So that is also some of what prompted a reduction. So what this policy does is it does reduce the commission from a 15-member commission to an 11-member commission. Right now, we only have 12 members. You might notice that we haven't filled those spots, and that's because this was going through iterations. You also will remember that each of you is on a 2-year voluntary cycle, and then when you get close, you get that email from me or from us, and it says something like, hey, we'd love to have you. Would you like to continue? If you'd like to continue, we need a letter. That still remains the same. However, given our number right now, which is at 12, we actually will have to reduce to 10, and that's because these categories where we fit, one was added by the Board of Trustees. They wanted a current school administrator or staff member to sit as part of the commission, and that's a great idea. I think we have a REIB right now, a student. We want to keep a student. This actually gives us the ability to have more than one student. It really allows us to have up to 2 people in each category, but we can't do that with just 11 spots. So I don't know how that'll work. It may fluctuate over time. So this effect, it goes into effect on July 1st. I know several folks, I think it's 6 or 7 folks are up at the end of this cycle, June 30th. And so you'll be getting those letters from me. And I hope you all still want to be a part of the commission. And what we will do, if everyone wants to be a part of it, is we'll figure out a fair, almost lottery process to narrow down the commission based in part on the category. So we will have to maintain the categories. I don't think we will have a problem with that. If for some reason someone is not able to continue who wants to continue, what we will do is hope that you will be willing to sit out a year and then the following year come back, assuming spots are available, that kind of a thing. That's the gist of it. It doesn't make a lot of changes other than that. It does define our meeting schedule. We don't have to meet more than quarterly. But I do think that monthly is too much, but I kind of feel like we've got about the right cycle now. That's like 6 meetings, 3 in the fall, 3 in the spring. So I am happy to try to answer any questions you might have, assuming you have some.
Any questions, discussion from the commission?
I want to know on that makeup, we're down, we don't have a first responder, right? Do you have to have one in every category, or is it, these are the categories we would like to have?
No, I think the intent is we have someone in every category,
Okay.
but I think we can also sort of be creative in how we interpret these. In terms of emergency services, Chris, I think, fits in there. Liz Flores fits in there. Peg Samples fits in there. And I think, I might be wrong, but I think right now Peg and Liz are both listed as at-large members. You're a parent. We have a parent. What's not here that used to be here is a government representative, and Ms. Bybee fits there, Jessica Gogachia fit there, but both of them could fit in other ways, either at large. Jessica is also a mental health professional. We have mental health professionals. We have Arib as a student. What we don't have is the school-based member. That's the only one we don't have.
Any other discussion? Yes, Commissioner Bybee.
I think 11 makes a lot more sense. When we started this, we did not have 15. I'm sure we did not. It kind of grew. And we had a lot of people from the same area, from a lot of counseling and behavioral health, which were awesome. But I kind of felt that it was so many people to get a quorum, for starters, and that we were too heavy in one area and maybe not another. So I appreciate really spelling out those categories, which are important categories, that we have at least one from each of those, and then we can decide where the second representative. And I think it makes sense to put someone from the schools, have a school-based member, we've got parent, we've got a student, and those are critically important. But I think going to 11 makes a whole lot of sense. 15 is herding cats, I'm sorry. Yeah, every commission and board I sit on, if you've got 7 or 9, 11 is even big, but 15 is too much. So I appreciate that.
Any other discussion? No? Okay. Thank you, Dr. LaMarca. Thank you. All right, that brings us to the end. And our next meeting is June. Oh, yeah, sorry. Do we have any general public comment?
No general public comment.
Okay, great. That brings us to the end, and our next meeting will be June 1st, 2026. And with that, at 3:12, we're done. Thanks.